Okay, so what are our applications for this superficial heat? And again, just a reminder, we're talking about 1 to 2 centimeters deep with these applications. So first, quick review again of our physiological effects. So the surface of the skin will get about a 6 to 8 degree Fahrenheit increase. Muscle or tissue about 2 centimeters deep will get us to about 3 to 5 degree Fahrenheit increase, or 2 to 3 degrees Celsius, which again gets us to kind of that moderate level. If we need anything deeper or stronger, we really got to be thinking about either exercise or our deeper modalities like diathermy and ultrasound. Blood flow usually doubles, metabolism increases, we get decreased pain, decreased soreness, decreased muscle spasms, and decreased tissue stiffness if we can get to that vigorous heating level. It decreases pain less than cold. It doesn't facilitate exercise actually as well as cold does either. It's again better for stiffness and soreness. So if you're in acute rehab, we don't really want to exacerbate that swelling more, so we wouldn't usually use our heat. And so heat's effects are usually less important as starting the exercise sooner. And so we'd rather use the cold to facilitate that exercise if that's going to work better than starting the heat and trying to facilitate exercise that way. Especially because the exercise would also potentially stimulate the lymph removal and increase the blood flow. And so maybe we don't even need to use the heat. So when we do use it, general soreness and aching, reversing joint motion restrictions. So if someone has had a joint contracture or something like that, again, that's usually best with deeper heating, as well as potentially you always got to do it with flexibility, with stretching. And then chronic rehab, or again, kind of preparing the body for activity. If that really seems to work for your patient, then you'd potentially use it. Okay, so let's talk first about warm whirlpool. So we talked about cold whirlpool, and our concepts are really the same: the buoyancy, the ability to do exercises in the water and potentially have either resistance or effects with that. You can also get kind of the massage from the jets, so that stimulation sometimes helps for pain relief, as well as, again, kind of that stimulation for muscle spasms. You get that convective heating, you get an increased temperature, you know, to get the results of the increased cell metabolism and things like that that we're expecting. Advantages: you can treat the whole body or a larger portion of the body, so multiple joints at once, by immersion in the whirlpool. We can really get at that irregular surface contact versus trying to match that with a body part and a hot pack. The temperature is really stable because you're using a big vat of water. The temperature maintains its level really efficiently through the whole length of the treatment, versus a hot pack that's going to be losing its heat capacity pretty rapidly as the treatment goes on. Disadvantages is you put someone in a warm tub, they're going to feel more weak and lethargic, so sometimes not the best right before activity, because we kind of don't want them to feel all sleepy after or before they go off to their sport. It will increase edema if edema and the tendency to swell is present, because you're in that decrease or that gravity dependent position, as well as the fact that it's warm, and that's one of the side effects of using heat. You can't use it with open wounds, or if you do, you'd really have to make sure you clean your tub really well and effectively. It's messy, it's noisy if you're talking about the jets being on, and it's not portable. Indications: general whole limb or whole body stiffness and soreness, superficial heat, and then sometimes as a supplement to other treatments. So again, if the person feels like it facilitates them participating or doing their rehab. Just FYI that we're usually talking about the warm whirlpool. So our contraindications: any acute injuries, any circulation problems, sensation problems, high fevers. We wouldn't want to increase temperature if someone already has a fever. Our general precautions: you're putting them in a pool, especially a pool of warm water, which might make them sleepy or lethargic, so we don't want to leave them unattended. Again, we don't turn our agitator on or the turbine or the jets on when the person is in the water. We get out to do that. We do it before they get in. You want to clean it between patients, especially if there's that risk of infection. Because you're now dealing with warm water too, there's a greater risk of bacterial growth. So it's best to clean more often than we would even with a cold tub. And again, like a lot of our feel-good modalities, it's not a cure-all, so we need to be making sure that they're participating in their rehabilitation and in the other modalities or treatment plans that are going to facilitate that exercise. Pre-application steps, all the same that we usually talk about: evaluate the injury, make your proper diagnosis, write your goals, and then match the indications of the modality to those goals. Check your contraindications, prepare them psychologically, check for open wounds, prepare them physically, prepare the equipment. So typically our warm whirlpools, if we're doing the whole body, is about 100 to 108 degrees Fahrenheit. If we're doing the extremity, we can do that a little bit higher and be about 105 to 112. So anything hotter than that is potentially dangerous, and so you want to be inside that range. So application: inspect the body part, check your sensations and distal pulse, check your capillary refill, turn on the agitator, put the patient body part or the full patient into the water, and then adjust your the direction of your jets and the amount of pressure the jets are creating. Then when it's done, remove the body part, inspect the area, check your pulses and capillary refills again. Then we turn off the agitator or the jets. The length is typically 10 to 20 minutes, and we do it 1 to 2 times a day potentially. And then our post steps are a lot like our cold tub. We need to clean the area and clean the pool, drain it, clean the individual, check the area, give our home instructions. With warm whirlpool, it's really important that we tell them to hydrate, document, and then maintenance is cleaning and polishing and making sure the GFI is up to code and all of those things. Okay, our next one is the hydroculator pack, which is by far our most common form of superficial heat. So also known as a moist heat pack, but hydroculator is the device that we warm the packs in. So the effects here, we get superficial increase in circulation, the increase in metabolism, increase in muscle relaxation. Advantages: it's really easy to use, it's local heat, it doesn't affect the whole body. We can treat multiple areas at once by using multiple packs. It's relatively inexpensive. We could treat over open wounds if they cover their open wounds versus, again, going into a tub and having the water and all of that. They're relatively durable because you're talking about a canvas pouch that's filled with silica or some other substance that absorbs a large number of water molecules, and in this case, warm water molecules. They come in a variety of shapes and sizes, so you can get ones for the neck, you can get larger ones for like the back, you can get smaller ones, lots of different sizes with that. They're portable, so the pack can leave and go. They have more heat than paraffin, which is what we're going to talk about next. They can hold their heat up to 30 minutes if the pack is heated to between 140 and 160 degrees Fahrenheit. So that's what it should be in the water. So then when we remove the pack, we will always wrap it in several layers. So typically we talk about wanting at least 6 layers of terry cloth between the pack and the patient. And that helps keep the constant temperature at the skin surface at about 115 degrees Fahrenheit. And that way we can remove layers as the modality cools, as the pack cools, to keep that temperature at about 115. So it's good for those areas where it would be hard to immerse in water, like the cervical spine. It's a little bit, as far as disadvantages go, a little bit more time consuming because you actually have to reheat those packs. This is probably what we do the least well about, because we let the patients grab their own packs at Gustavus, is that it takes about a half an hour for that pack to get back up to the 140 and 160 degrees. And so when someone puts it back in the water, if the next person comes and grabs that right away, it's not going to be fully up to its temperature, so then it's not going to get to the tissue temperature that we expect. And it's also superficial to begin with, and so that really diminishes its effectiveness. So there's actually ways that you can monitor that. If you look at the packs, They usually have two different color tabs that you can use to hang the packs on the little wire metal racks in the hydroculator machine. And so there's a whole theory that like you start in the morning and they're all on the white side. Okay, and then as someone uses it, they should flip it over to blue. And then that way you know that you use all the whites until the whites are gone. And then you use the blues and use all the blues until the whites. So you just keep flipping them as they come back in. And that way you know that it's one that hasn't been fully reheated yet. So, but no one really seems to do that. So how effective are we really getting with that? The weight of the pack can be uncomfortable for some people in certain body parts. It's really difficult to contour to the body as well. You're only getting that superficial heat. You can't really do range motion activities while the pack's on like you could when you were in the warm whirlpool, and it has really short-lived effects. So it's indication for any of those local superficial heat that we're talking about or as a supplement to other treatments. Contraindications, all of our general heat contraindications that we've already talked about. Precautions, we don't ever want the bare pack directly on the patient. That is too hot. Again, when that first comes out, it's about 140 to 160 degrees. That's too warm. This is another big one, this pet peeve of mine. You should not have someone lie or sit on the pack. That increases the compression, which will increase the amount of heating, which can be dangerous. Also, that pressure is more likely to rupture the canvas, and then you get the goo, the silica, leaking out, and you're more likely to break. So these are meant to be fairly durable and reusable, but not if people sit on them or lie on them. So you always want to put the pack on the individual. You want to check on the patient. You want to remove the layers of toweling. So if you are using toweling, you can remove those. When we use just the covers, that gets hard to remove because one of those covers is actually considered 6 layers of terry cloth. So we don't get to remove the toweling. Actually, in your book shows you how to fold towels to get you to your 6 layers for your pack. If you choose to do that. So the covers, you can't remove those layers. So sometimes you might actually need to replace the pack within your treatment time to keep the same amount of heat going. So even though you want to heat for 20 minutes, you might change your pack out after 10 to get some more intense heat again. They have to be able to communicate with you if it gets too hot. And it may take a couple minutes for them to feel the warmth. And so all of a sudden they're like, they want to sit on it because they want it warmer and they're moving around or they need something different. Just give them a few minutes and see it out. So pre-application steps, all the same stuff. The water, the moist heat pack is going to make their clothing wet. So remove their clothing or kind of get that space away. Prepare the equipment. So again, the machine itself should be at 140 to 160 degrees, which means then the pack as it makes contact with the skin through the layers should be about 115. And you should have that availability to remove some of those toweling layers. Some people might need more layers at the start. Some people might need less. So you need to take that on. It'll take about 30 minutes for those heat packs to reheat, as I mentioned. Big thing with that too is the machine always has to be filled with water. If the water level gets too low, because again, those packs are absorbing the water, that's how they work, then they won't heat regularly. So every day we should be checking that those levels are up to the top of the metal rack in the machine. Also, when people don't close the lid all the way, we lose steam out into the room, and so we lose the water level. So close the lids after they're being used. Patients are notoriously bad for this. So every time you walk by, check the hydroculator lids and close them. So our application, get the right sized pack, let some moisture drip off, check the body part, and then put the pack inside the toweling or the cover and adjust the pack so that it doesn't have excess pressure over any bony protuberances. Remember, don't let them lie in it. You can insulate with extra toweling. You can even put toweling over the top because, again, we don't want to lose all that heat to the atmosphere. We want it to go down into this tissue. So we can put some more over the top. Inspect the area when we're done. And again, allow time for the hot pack to get re-warm before using it again. So figure out a way that you can monitor that. Length of time is usually 20, 25 minutes, maybe up to 30. You can do it about 2 to 3 times a day as long as you have about 3 to 4 hours in between. But again, you got to start thinking like, why am I doing this? And is it really effective for my patient? Should they be exercising? Should I be doing a deep heating instead of superficial? And then again, whenever we're dealing with our heat, one of our instructions should be to hydrate. Clean up all the towels and the covers, get the pack back in the hydrocculator. Here's some more of that maintenance. Ensure the water levels bi-weekly. You should drain it and clean it and fill it with new water, which is not a fun task, but it's really important to do that. And then discard anything that's broken, because the packs will leak into the unit, and then you have to clean the unit. Don't let packs dry out. And if you're going to store packs for a long period of time, place wet packs in an individual sealable plastic bag and store them in the freezer, actually, so that they don't dry out. Okay, our final form of superficial heat that you're going to be responsible for is a paraffin bath. And so this is using wax. And so it's a mixture of wax and mineral oil, and it's used to deliver heat to small, irregularly shaped areas such as the hands, fingers, wrists, foot. And so the effects are you get all those kind of superficial heating effects. Advantages is relatively easy. You get local heat. The paraffin also softens the skin, which is kind of a nice added bonus. It's relatively uniform heat, and it's relatively inexpensive. The disadvantages is it has a whole lot less heat than hydrocculator packs. It's harder to generate the heat. Also, depending on the mechanism that you use, it can have dramatically less heat. You're limited to really only hands and feet and to the size of your paraffin container. It's relatively messy. The wax is messy. Again, it kind of gets a oil on your skin. It usually has kind of a smell to it that some people don't like. Ideally, you want to be able to reuse the wax, but eventually dirt and debris accumulates in the wax and you have to throw that away. So ideally, you want the person to wash their hands really well, shave so that we don't get a lot of hair in the wax. You can observe the area being treated really well, so it's a little more tricky to monitor to make sure that they're safe. It's not very long-lasting heat, and you can't really perform range of motion activities while you're getting the treatment. So indications, you're going to get local heat to the hands and feet, and it's, again, a supplement to other treatments. So for upper extremity, the paraffin typically is heated somewhere between 118 to 126 degrees Fahrenheit, and lower extremity is typically between 113 and 121. Our machine, you can't actually set the temperature. I believe it's set at about 115 to 120, I think, is what our paraffin is set at. I think it's 120. But refer to your manufacturer's kind of maintenance requirements and see what that entails. So contraindications, all of our heat, burns and scars can be especially painful using paraffin. So you wouldn't want any of that in the area. Check the temp of your paraffin, make sure it's not too hot. The skin has to be dry, so it should be really clean, but it has to be dry because that wax will interact with the water and cause some burning. Cover any scratches that might be or any wound issues. If there are wounds, it's just not a good idea to use the paraffin in general. As we do the paraffin, one of the things we do is create these layers of the wax, and if they move their hands a lot, that will create some cracks in the wax, which will let the more hot wax get underneath, and that can cause an uncomfortable and potentially burning situation. So you want to watch for seepage under, and that should be previous, not precious, under the previous application to make sure that they're not at risk for that. So pre-application steps kind of are same. We got to make sure the equipment that the paraffin's melted. Check that the temp that it's all melted. I take that back. Ours was at 126 degrees Fahrenheit. That's our typical. You don't want it any more than 130 really. That will just be too much. Also warn them that their hands will probably be slippery afterwards. I've seen people try to like open the knob of the door to the athletic training room and their hand slips a lot. So it's just a good little warning to give them when you're preparing them. So application, we have two different types of application. We'll go through each one. One is called an immersion method and one is called a glove. So we'll see that in the next slide. But basically we want layers of this wax in order to help hold in the heat. And the treatment time is usually somewhere between 20 to 25 minutes. Frequency is 2 to 3 times a day with at least 3 to 4 hours in between. In our post-application steps, we want to remove the paraffin So again, if we do a really good job that they've shaved and they were really clean, we can remove that paraffin and that wax off of the hand and put it back in the paraffin and let it melt, but only if it's clean. Give our instructions, document, and then our typical maintenance. Look for any dirt and scum, replace the paraffin as needed. So the first one we're going to talk about is the glove method, okay? So wash and dry the extremity, check for any open lesions, any skin infections, shave the hair, check your distal sensations and pulse, and then explain the treatment and what's going to happen. Check the treatment temperature of the bath, again, usually about 120 to 126. And you're going to immerse the part slowly, keeping the joints nice and relaxed because we don't want them to move their joints during this. So we dip it in the wax and then pull it out and let the paraffin cool for about 10 seconds. And we repeat that up to 12 times. And so we get this layer of wax around the hand or the foot. Then we're going to put that in an ice bag and then wrap that in towelling or in our hydroculator covers, something to insulate. And then you support the area during the duration of the treatment. And you don't want them wiggling their fingers or moving around because that will crack the wax and let the heat escape. So then when the treatment's over, we peel off the paraffin, either discard it or put it back in the bath, and then re-look at the body part. Again, ideally that lasts for 20 minutes, but we know that paraffin does not last that long. And so you're probably only going to get heating for maybe 5 to 10 minutes. And actually one of your activities will have you kind of testing that. The immersion method gets you much more heat, okay? The immersion method, you go through the same 8 steps, okay? So you create 6 to 12 dips and create your glove. But now instead of putting it and moving it and putting it in a bag and warming it that way, now you dip it and keep it in the paraffin and keep it submerged for the rest of your treatment for 20 minutes. And so that gives you much more heat. But some people, it's even too much heat to tolerate. Plus, you're really tied to that paraffin. So you got to make sure the patient's really comfortable, that they're comfortable with their hand in that spot. Again, you don't want them moving their joints too much because you don't want to cause any cracking. And then same thing, after the treatment's over, let the wax that's on there kind of drip off and dry, and then you can remove the wax and put it back in or discard it. Okay, just some final other superficial heating devices that we have, or that you might see. Infrared lamps, we don't see a whole lot. They burn really easily, so they're not used a lot therapeutically. Flutotherapy, your book goes into flutotherapy a lot. I had it when I was in grad school. We had a flutotherapy machine. Basically what it does is it does convection healing. So it's sometimes called a dry whirlpool because it circulates warm air in a bed of fine solid particles. So they're almost like little like corn husks or little pieces of that. And it's good for, you put an arm or a leg in, and then it kind of gets a heat and massage somewhere between 102 to 118 degrees Fahrenheit. And it helps to kind of maintain the treatment. You can do it over splints since it's not water. You don't have to worry about getting it wet. You get to set the airspeed. You can set the timer and the preheat. You can set it to pulse and have the heat on and off to help regulate the temperature. You obviously can set the temperature. So it's something you might come across, but we don't have one here, so it's not one of your competencies. Electric heating pads, those are good when you're on the road and potentially don't have access to moist heat or hydroculator pad. Some of them have little sponges that you can get wet to try to get a little more moist heat, which is always going to help exchange the heat better than dry heat. But they're not overly effective. Portable heating products like thermocares, where when they're exposed to air, they actually heat up and get that exothermic reaction. Those produce heat, and that heat can be transferred. It doesn't go very deep and it doesn't last very long, but you are actually producing heat. Versus topical analgesics like Icy Hot or Tiger Balm or some of those that, we talked about those producing cold sensation, but they also, some of them are sold as creating heat sensations, and they're not actually heating up the tissue at all. It's all a counter irritant and a pain reliever, but it doesn't actually create any heat and thus none of the physiological effects of the heat. Finally, just a little overview of some of the evidence that this chapter talks about. So the amount of temperature increase required to enhance the plastic properties of a collagen-rich tissue is really unclear. So we believe it's at that 3 to 4 degree increase mark. We see some of that anecdotally. We see some of the benefits, but the research is kind of mixed on that. Increased collagen elasticity is improved when the target tissue temperature does reach 104 degrees, but we don't necessarily know how well that gets there. At temperatures greater than 95 to 97 degrees, that's when we have the enzymatic deterioration of potentially articular cartilage. And so again, we want to be careful potentially with arthritises that we don't get too high. Though paraffin is a really good treatment for pain relief for arthritises, again, especially hands for rheumatoid arthritis, but you have to make sure that we're not getting into that vigorous heating stage so that we don't get any potential deterioration.